Hi, this is Dr. Joe McLaughlin, and I'm the Chief of the Alaska Section of Epidemiology and the State Epidemiologist. I wanted to take a few minutes to provide all Alaskans with a brief overview of the epidemiology of COVID-19, which is the disease that's caused by this novel coronavirus that's currently circulating. I want to focus on giving Alaskans information about how the virus is transmitted and the incubation period, signs and symptoms, things like that, and then talk about how we can prevent transmission of the virus on an individual level and collectively. So to start out, this virus is transmitted primarily through respiratory droplets, primarily through coughs and sneezes. And that's why we recommend that people keep at least 6 feet away from folks who may be coughing or sneezing or may be sick with a respiratory infection. Those respiratory droplets that you cough or sneeze out typically fall to the ground after about 3 to 4 feet. So if you're staying at least 6 feet away from somebody, then your risk of coming into contact with some of those respiratory droplets falls off dramatically. The other primary mode of transmission of this virus is through touching surfaces that have been contaminated with the respiratory secretions of somebody who is sick. And so frequently touched objects like doorknobs and handrails and desks and chairs are potential vectors for transmission of this virus. So what would happen is if I were sick and I coughed on my hand and then I touched a doorknob and then you came up and touched that doorknob shortly after and then touched your eyes, nose, or mouth without washing your hands ahead of time, then that would be a way that you could become infected with the virus. And people really understand why if you touch your nose or your mouth, you might get a respiratory infection. But sometimes people ask me, well, why would I get infected with a respiratory infection if I touch my eyes? And that's because your eyes have tear glands in them. And those tear glands actually drain into the back of your throat. And so that would be a way for, if your eyes got contaminated with the virus, for that virus to make its way into the respiratory system. This is why we highly recommend washing your hands frequently. And the best way to wash your hands is with regular soap and water. Now, if I've been in a high touch, in a frequently trafficked area, I will typically wash my hands twice. So I'll do it for about 20 minutes and then 20 seconds, and then I'll wash them again for probably another 10 seconds just to make sure I've gotten all of the virus off of my hands. Another question that comes up is the incubation period. And the incubation period is after a person becomes exposed to the virus. So let's say I'm sick and I cough on you. So now you've been exposed to the virus. How long will it take for you to develop symptoms? And the answer is anywhere from 2 to 14 days. On average, people who are exposed to the virus will become sick within about 4 to 5 days. That's the average, but the range can be anywhere from 2 to 14 days. And what are the symptoms? Typically, people present with a fever, and oftentimes it's a low-grade fever, anything around 100.4, 100.8, something like that. And then a cough, and usually it's a dry cough, and oftentimes it's a mild cough initially. Sometimes people can present with shortness of breath, although that typically comes a little bit later for people who are infected with the virus that causes COVID. Other common symptoms that we're seeing, people will report myalgias or muscle aches, as well as fatigue. Sometimes people will have sore throat, although that's less common. And sometimes people will report a headache, nausea, even diarrhea. But the most common signs and symptoms are low-grade fever, cough, and potentially shortness of breath. Those symptoms typically last on the order of days, probably 3 to 4 days for most people. The vast majority of people who come into contact with COVID, the virus that causes COVID-19, and actually become infected, they develop symptoms, they'll have a mild to a moderate illness, and they are not needing to be hospitalized, and oftentimes their symptoms will go away within a week. Sometimes people will develop more severe illness and require hospitalization. And right now, based on the data that we have coming out of China and Italy and some other places, it's probably on the order of about 10%, give or take, of people who develop COVID infection will require hospitalization. The people who are at risk for more serious illness, so these are folks who are at increased risk, include people who are in older age brackets, starting at about age 60. And the risk actually increases incrementally the older a person gets. So people who are above 60 are at higher risk than people who are aged less than 60. People who are older than 70 will be at higher risk than people who are older than 60, and so on. So age is an independent risk factor for illness. The other thing we're seeing is that people who have underlying medical conditions, especially if they're serious medical conditions, also appear to be at increased risk for more serious infection with COVID-19 or more serious disease, and they're at higher risk for hospitalization. So these would include people who have heart conditions, lung conditions, diabetes, immune compromising conditions, and there are a number of other conditions that may put people at increased risk for severe illness. So this is why we're seeing very high rates comparably compared to the rest of the population in the elderly, is because not only are they in older age brackets, so they're at increased risk for that reason, but also the elderly tend to have more underlying medical conditions. And so they really are the most vulnerable population in our population with respect to this novel coronavirus. And we really need to do whatever we can collectively to try and help prevent transmission to these individuals. In terms of viral shedding, this is a question that's frequently coming up. How long after a person becomes infected are they actually able to transmit the virus to other people and infect other people? The answer is it really depends on the individual. For most people who have mild to moderate symptoms, the period of communicability, the period when you're actually shedding virus in your respiratory secretions, probably is on the order of days. And what we're seeing from the Centers for Disease Control and Prevention is some of the data that they've released or relayed is that people tend to have the highest viral loads and transmitting virus within the first few days of symptom onset. And so if I become sick with COVID-19 today, probably I'll have most virus in my respiratory secretions from my nose and from my mouth within about a day or two. And those viral loads, the viral transmission tends to really decrease after about probably 3 to 4 days, such that by about day 7, for people who have mild illness and their symptoms resolve within, maybe 5-6 days, by about day 7, what CDC is recommending is that they can actually they can come out of isolation because they're no longer transmitting the virus. And this would be people whose symptoms have pretty much resolved by the 7th day, and they have not had a fever for at least 72 hours. So those are the criteria that CDC is looking at for releasing people from home isolation. These are people with mild illness. Now, there are a subset of people who develop COVID-19 that have more prolonged illness, and some may require hospitalization. And so the period of communicability for those people, the duration of viral shedding in their respiratory secretions, probably is longer than that. And so it could potentially be that people who have prolonged illness may be shedding virus potentially for weeks. And so that's why it's important particularly if a person is hospitalized, the healthcare provider will make that determination as to when that person can come out of isolation. Fortunately, we do have a very reliable test for COVID-19. It's called a PCR test, or polymerase chain reaction test. And we have this testing capacity at our state public health laboratories. We have 2 laboratories in Alaska. One is in Anchorage and one is up in Fairbanks. And there are also a number of reference laboratories like LabCorp and Quest. These are large national reference laboratories that are also doing testing. So we can submit specimens to our state public health labs as well as to reference laboratories. Right now, our state public health labs are doing testing every single day, and our turnaround time, once the specimen makes it to the lab, is about 24 hours, so it's a pretty quick turnaround time. In terms of treatment, people who are ill, the treatment right now is supportive care. Pain medications, fever medications, liquids for people who develop shortness of breath or for people who have more serious illness and require hospitalization. Then other treatments, supportive care treatments, are available for those hospitalized patients. We do not have any specific antiviral medications that have been proven to be effective against this novel coronavirus. There are a couple that I'm sure many of you have heard about. One is called remdesivir, and I'm sure people have heard most recently about chloroquine. So there are a number of potential antiviral medications that are currently being studied. We know that there are over 100 clinical trials that are currently underway globally to test novel as well as repurposed compounds against SARS-CoV-2, which is the virus that causes COVID-19. In terms of prevention, so this is one thing I really want to underscore during this conversation we're having, is how do you prevent transmission? And the big recommendations are, we already talked about staying at least 6 feet away from anybody who's sick. And in general, when we're doing community mitigation like we're doing now in the face of a novel epidemic of a novel virus, is we want to really avoid close contact with anybody that we come across in our community, at least for the near future, because you just don't know if somebody is sick or not. So we really want to practice social distancing. As well as hand washing, we talked about that, ideally with soap and water for at least 20 seconds. And if soap and water is not available, it's okay to use an alcohol-based hand sanitizer as long as it has at least 60% alcohol in it. We talked about the importance of not touching your eyes, your nose, or your mouth if you haven't just washed your hands. And that's because your hands often get contaminated with all sorts of bugs, viruses, and bacteria. And if you touch your hands or your eyes, nose, or mouth, then that's another route of infection. We really want to underscore the importance of cleaning surfaces with disinfectants. And fortunately, what we know about this novel coronavirus is it does not do well with even just household disinfectants. So that's good news. We want to make sure that people are disinfecting, especially those high-touch surfaces. If you do become ill, this is something that if you don't come away from this presentation with anything else, I hope you come away with this one main message. If you do become ill with any respiratory symptoms, cough, fever, shortness of breath, or even other symptoms like chills, muscle aches like you would feel when you're getting the flu, for example, even especially if it's combined with a headache, any inclination that you might have a respiratory illness, I want you to please go home and self-isolate to protect your family and the community. This is going to become increasingly more important as we start to see community transmission of COVID-19 in Alaska. We know that we're already seeing cases here, and it's going to be just a matter of time before we start to see community transmission of this virus. And so I really want to underscore, if you start coming down with any signs or symptoms of illness, or your child does, a respiratory infection, stay home. Don't go to work. don't go to school, don't go to the shopping center, don't go to the grocery store, stay away from other people. This is one of the most important things that you can do to help prevent transmission, not only of COVID-19, but of other respiratory viruses that are currently circulating. One question that I know comes up a lot is, when will we have a vaccine for this virus? It's probably at least a year out before we'll have a vaccine available to prevent infection with this virus. So the next thing I want to talk about is community mitigation strategies. These are strategies that we can take to help prevent transmission of the virus. And these are especially important when we don't have an antiviral medicine that's available to treat infection, and we don't have a vaccine that's available to prevent it. So the major tool that we have in our toolbox is community mitigation. There are three primary sort of categories or areas that we sort of lump community mitigation into. One is personal, another is environmental, and the third is community. So on the personal level, what can you do to prevent transmission of the virus? Not only from acquiring it yourself, but if you become sick, how do you prevent transmission to others? And we already talked about these things for the most part. It involves isolation if you're sick, and if you have known contact to a confirmed case of COVID-19, to put yourself in quarantine. The question is, how long do you stay in home quarantine? Well, we talked about the incubation period being anywhere from 2 to 14 days. And so that's why the quarantine period is 14 days. So you want to be at home, especially if you've had known contact, close contact to a confirmed case of COVID-19. We want you to be at home for 14 days. How do we define close contact? Generally, we define it as being within 6 feet of somebody who is symptomatic, who has the illness, for at least about 10 minutes roughly. Now, it changes if somebody who's sick with COVID-19 just sneezes on you. I mean, it doesn't take more than a second for that to happen, and then suddenly you're exposed. So those would be close contact situations. So those are the people that we'd want to be in home quarantine if they came into close contact with a confirmed case. Other things we can do, we talked about hand hygiene as well as respiratory hygiene, covering your coughs and sneezes if you're sick, especially if you're not already in home isolation, you're around others and suddenly you start feeling sick and you've got a cough that comes on or a sneeze. We want you to cover those coughs and sneezes. If you have a face mask, it's okay, it's appropriate to go ahead and put that face mask on if you're symptomatic. Now, we're not generally recommending face masks for people who are not ill, but for people who are ill and coughing, sneezing, things like that, we want you to put a face mask on to protect others if you're going to be around others, if it takes a little time before you get home. We talked a little bit about the environmental community mitigation strategies, surface cleaning. Again, this virus does not do very well with regular disinfectants, and so we want people to disinfect with household disinfectants those high-touch surfaces. And then we get to the community level mitigation strategies. These include strategies like working from home, teleworking, liberal leave policies in the workplace, closures of schools, social distancing, we talked about this, modifications of mass gatherings. We want to minimize the number of people that we're coming into contact with as much as possible. We talked a little bit about travel, avoiding travel. There are travel advisories that have been put out by the Centers for Disease Control and Prevention. Right now, because this pandemic has spread across the globe, we're seeing community transmission in many, many states now, and I suspect in the near future, virtually every state is going to have evidence of community transmission. So during this time, it's very important to minimize any unnecessary travel. So these are some of the things that we can do to blunt the epidemic curve, and I'm sure many of you have heard that term before. So what does that mean? So when you have a brand new virus that emerges in a population, such as the virus that causes COVID-19, essentially the entire population is vulnerable to becoming infected with the virus. And so the virus can potentially be transmitted to everybody on the planet. And so what we want to do is we want to minimize as much as we can the number of people who come in contact with this virus over time. And so if you don't employ any community mitigation strategies at all, what happens with the epidemic curve is it looks like an orange construction cone. You've got a very steep increase in cases per unit time, and then at some point, the case count per unit time will peak. It'll hit a peak, and then it'll start falling off very dramatically because the virus has swept through the population very quickly. The problem with that scenario is imagine a dotted line that bisects that cone at some point. And it's a horizontal line. So that line represents the threshold above which we overwhelm the system. We overwhelm the healthcare system, the hospitals with way too many cases for them to handle, and we overwhelm the public health system to be able to do our contact tracing for cases, making sure that cases get into isolation and their close contacts get into quarantine. It just becomes too much. And so what we do to prevent the epidemic curve from looking like one of those orange construction cones is we employ community mitigation strategies to turn that epidemic curve into looking more like a loaf of bread, or I like to say ideally something more like a loaf of French bread. So it never gets above that horizontal line above which you start to overwhelm the system. And that's the thing we want to avoid. So the more people who really follow the recommendations, the guidance, the mandates that have come out to increase social distancing, minimize the risk of transmitting from person to person, the more likely we are to be successful in blunting that epidemic curve. So I want to refer people to our website, which is www.coronavirus.alaska.gov for more information, as well as the CDC's website, which is www.cdc.gov. Those two websites have really helpful information for the public, and we are updating these websites frequently, and we are also providing information through social media and through media interviews. And so I really want people to please stay abreast of the new information. As you all know, this is a rapidly evolving situation, and it's very, very important that everybody stays informed. So thank you so much for your time. I really appreciate you listening to this discussion.